we want to really do now is really think about, turn our attention actually a lot closer in, which is over the next couple of years, what's possible? What are we talking about over the next 3 years that we can accomplish? You know, the name of this symposium is both the advancing HHS interoperability, the state of the art to the art of the possible, and we've talked about that a lot over the last couple of days. Where we are now, where are we going? But the where are we going in terms of the art of the possible is really actually a fairly constrained concept. It's not that visionary thing, where do we need to go long term? We need to keep the future in mind, but we need to think about what are actionable steps that we can take as a community. And I do think of us as a community. The 125 or so people that are here today are part of about 1,000 people who've come to these symposium over the years. So there is in fact a community of people who are thinking about this stuff across the country that don't necessarily have a centralized place to have those conversations ongoing. And so I was inspired earlier as we were preparing for this symposium, and thanks to Paul for introducing us to Shemendra and the work that he's doing at the information sharing environment, to really think about what is the direction that's happening, and how can we take advantage of this as a community. And as we read a lot of the material on the information sharing environment, we really began to see ourselves in that community. And you've articulated it in a way that I think we can see ourselves. And we feel like there's a sort of a fellow traveler that we can meet up with and take advantage of building what the future might look like. I know our experience, and both personally and as a group with Jess Kahn and the heroic work that she's undertaken the last number of years to move forward on the Affordable Care Act, and now they're taking over the controls of state systems for Medicaid are really commendable, and many of you, if not everyone, has had some interaction of her openness and her willingness to think about it, and most exciting, her ability to say health and human services, and at her core, I know she really believes in that. And then Damon Davis, who I've gotten to know over the last couple of years, the work that he's championing with Brian Civic at HHS on open data and what that world looks like. We had a little bit of view into that yesterday with Dwayne and Dr. Shaw about what that tsunami of the future holds for us. It's incomprehensible relative to what's coming. So this next section here will be to ask those three individuals to come on down, as we say, and to share with us some ideas, some thoughts, as we sort of warm up to this conversation. And at this point, it's an opportunity for, what I'd like to do is ask them to take a few moments to give us their thoughts on what are some of the most exciting and promising developments, from their vantage point. And we have an opportunity now to hear a bit about that, and also maybe ask a few questions. What we're going to do is we're going to actually turn the tables after this panel is done, and then they're going to, along with some of our other federal partners, be able to ask us the questions about what our plans and thoughts are after we go through some interactive session discussions here, right? So it's, I think, a relatively unusual opportunity to actually have this two-way dialogue. Oftentimes we hear from them in large conferences and ask a couple of questions. And I think the reason the room is filled here today is because there's a real hunger to have this federal, state, local conversation and how we can move forward in that. So with that, I would just ask, maybe Jess, would you like to start just giving us a sense of, what, as you look out into the near horizon, what you see as a possibility?
Okay. Good morning. As luck would have it, we can't keep up with my bio because I am apparently so infected with the Medicaid in-chip data and systems bug that I just kind of keep getting plugged into different roles in different places, and that doesn't bode well for my social or family life, but it does make it hard to keep my title straight on a slide. So I'm actually now the incoming group director for data and systems for Medicaid and CHIP, which is good news for this discussion because it's not just state systems, but it's also all of the data that we collect from states about encounters, providers, beneficiaries, third-party liability, outputs, inputs, all of those things. So that when I get to that, you'll understand why I find that so exciting. So I wanted to just sort of lay a little bit of a 2-point map of where I think we are now, and I think we're still at an interoperability place that's fairly point to point from what I'm seeing. And so I either mean sort of state to fed, if we can interoperate, we all go, wahoo, just one point to point, or in a state between 2 federal agencies, we share data, and everybody gets all excited. Or shared services in an eligibility system. It's still just one thing, point to point. And where I want us to see us going, and there's certainly some nascent work here, and there's some barriers and some opportunities, it is more overlapping spheres instead of the point to point. And so data is generated, harmonized at that organic level so that we stop just saying, what do I need to know about this person because they're a Medicaid beneficiary? Oh, they're also in foster care. Oh, they also have an interaction with the juvenile justice system. What else do I need to know about them in order to truly impact their care? And it's easier to collect that and understand that where that data resides than to send it out to 5 federal agencies and expect us to somehow mash it back together and then give it back to states. So we want to talk about how to have those overlapping interoperability at the organic level, and then also system development at the enterprise level, which I know there are people, Tom and Ivan and others, who've been on this bandwagon for a long time, but it's still surprisingly not as common as it should be. And I mean that like at the conception of what we want to do at the enterprise level, not retrofitting, because now we drank the Kool-Aid. So to get the pathway forward, and this is my broken record piece, but it's not a technology problem. If there's anything that the past year of excruciating pain has taught us, pausing on excruciating, really, is that it's, Oh, I'm telling you, we should have a happy hour after this session. It's governance. It's governance. We're not going to have system, hello Joe, we're not going to have system interoperability and people who are willing to put all that data together unless the people are actually willing to sit in a room together. And they're actually willing to share their funding and not get all hung up on who's in which role and how and which agency. And where I see this working really well, I can tell you the names of the people who are making that happen. It's still a cult of personality. It's still really smart, committed people. And while that thrills me, they're going to retire someday or go away. And then what do we have? We have it institutionalized, this idea of governance comes first. And it's so frustrating to me at this point that I'm starting to think about, before we approve advanced planning documents, we're not just going to talk about your alternative analysis for a system. We're going to have a good long conversation about governance. And that's going to have as equal a weight in our assessment of what the state wants to achieve as which vendors they're going to pick and which enterprise service bus or rules engine they're going to go with, because that's killing it. It's killing it in a bad way, not in a good way. I have a 16-year-old who often flips all of my adjectives to be the opposite meaning. So, be careful when I say something's killing it. So then the thing, I'll own some part of it, we should own some part of it, which is that we haven't realigned our funding incentives for this either. We talk a good talk, but we still pay more money for things to be built ground up. We don't attach any financial responsibility towards governance whatsoever. We probably fund the people who do that at 50% if I really looked into it, right? So we really need to take a good look and are going to, this year, the next 12 months, at our funding incentives and disincentives. So instead of just saying, oh, we want you to interoperate, we want you to do reuse, we want you to leverage COTS, we'll still say those things, but we'll also say no when you propose something to the contrary, which is a little more forceful than CMS has been in the past. But again, back to that excruciating adjective. We're not going there again. And I think that we can provide the right incentives so it's not just a negative story, but there's a positive reason to go that way as well. So not to hog this, I would just say if you have the vision, which I think collectively we do, and we have the persistence. I told Daniel it's so nice to see the frequent flyers here every year, people who just really buy into this and are still on the path, that persistence, and I think we're going to get to the sea change, but it takes both sides for us to get to that pathway forward.
It's great to hear the focus on governance and hear it in a visceral and emotive way, because it's so central. And you guys are holding up what we've done with the information sharing environment as a little bit of a role model or a path forward. So let me tell you all the things we screwed up. And we talk about best practices, but let's talk about the hard-won lessons learned to build on the theme that Jess started with. We governance, in an abstract way, it's accepted best practice when you want to do cross-boundary sort of things. But usually what happens, especially when you have powerful agencies involved in organizational culture change and stovepiping of appropriations and oversight and an industrial age organization in the public sector, is that governance means do it my way, right? And you get into these deadlock kind of conversations. The flip side is that, I talked about the National Network of Fusion Centers that came up after 9/11. That was an organic response. So that came up without any real plan or organization. And then you have a lot of fragmentation and duplication. Now, what is, I guess I will say the benefit of what happened in the public safety national security space is the horrific 9/11 event. It was such a shock to the system at the federal level, at the state and local level, that we were able to break through a lot of culture sort of issues. So maybe the experience with healthcare.gov and the kind of current imperatives provide an analog to get past the culture change issues at the individual level and the organizational level. I think at the organizational level it's much harder, because all the organizational incentives go in the wrong direction, right? Because when organizations are under stress, what do? They go in the bunker, they hunker down, they tighten up, right? And that's exactly the opposite sort of behavior for the kind of network of communities we need to build to be successful. So, the thing I'd like to highlight, and before we get into the discussion, is the importance of building community. We've talked about that. I highlighted that. There's three aspects to it that I try to be practical that I'd like to highlight. And I use this phraseology: the bottom up, the outside in, and the top down. And that's an order. That's priority order. So the bottom up, it's important to recognize in the health and human services, just like public safety, the community I come out of, the vast majority of crime, of issues are state and local. Now, something like terrorism-related activity is a federal kind of thing, but you can't lose touch with where the majority of the effort is. It's the state and local, the cities, counties, the states. So it's critically important that the community that you all are looking to build is anchored with those practitioners that are at or near the front line, right? That are the face of service delivery. I think that the focus that Stewards of Change brings on personas, as an IT guy, we call them use cases, actors, individuals that have a life cycle where they're consuming delivery. These are, in the world I come out of, core enterprise architecture type ideas, but I think you do a good job in terms of making them accessible, real, emotive, to generate a conversation. So I think that the leadership in this community really does need to be anchored kind of bottom up. How you do that becomes interesting, right? Because all our structures are top down, right? The funding flows that way, and so forth. I think an outside in piece is important. Looking around the room, it's great. There's leaders across the public sector and human services, but we're kidding ourselves if we don't recognize that industry, the current procurement pathways exercise huge amounts of influence. So it's critically important that we engage with industry, NGOs, advocates. On the advocacy side, I think it's important too to think about the privacy, civil liberties, civil rights kinds of issues. We talk about mental health, right, and shootings, and how do you share information between those two communities? And each community has different norms and rules about how to handle information, right? But it's critical to think about how do you share this information across those organizational boundaries, and that goes to an open engagement with advocacy organizations. That sometimes is difficult when you're at the federal level, right? To be able to engage in touchy issues around guns and mental health at the federal level is a much harder conversation than having a more open grassroots conversation about things like that. I could imagine that. That's not my space, but I'm reflecting on what we did with suspicious activity reporting, right? It was taking a national approach to tips and leads and doing that in a way that is neighborhood watch for the nation and not something else. Finally, it's the top-down piece. It's important that the community building has that federal sponsorship. I think it's important that at the federal level, though it's broad-based, one of the lessons we learned is that individual agencies all have organizational equities, and if it's, if a community is anchored with a specific agency, that agency tends to be overpowering in terms of the agenda. So it's important that it's, kind of an open approach. It's great that somebody is here from, HHS corporate, having that broader sort of view. So I think that's important, but I think it's in that order. You got to build from the grassroots up. We need to be, you need to have the industry involvement from advocates. Stewards of Change is, it's a great forum you're running here, and maybe there's an opportunity to expand on this, but however that evolves, and then the top-down piece. A few other thoughts. I made this comment earlier. It was made in the previous panel. The edge cases are very interesting in terms of information sharing. That's where there's a lot of barriers, between the public and safety and public health community. I'm more on the public safety side, but things like the prescription drug monitoring programs. There's a new, wave of heroin coming across the country that, because we're starting to get a handle on the prescription drug problem, there's a market, and because the prices of prescription drugs on the street have jumped, heroin is a lot cheaper, a lot more pure, and it's a real problem, and an area maybe where there's opportunities for more collaboration. And then the mental health issues around guns. And as I think about that, I really do draw the analogy with what we were doing 5 years ago with suspicious activity reporting, and making sure that we were engaging with the advocates, the ACLU, EPIC, Electronic Frontier Foundation, and all the rest to create an approach that was behavior-based, right? That was transparent, and that was really the key to the success. Local control, not a federal program, but a program that was controlled in the states and the regions. Final thoughts: speed, quality, cost. Right? You can have it fast, you can have it good, you can have it cheap. You can't have all of them. I recommend you trade off speed. It's a little bit interesting. These community approaches take time. It takes time to build the health of the community, the effectiveness of the community. But if the community is anchored in solving a shared common problem, right, you can build capacity. And over time, you can solve a lot of problems a lot more effectively. So, that's some thoughts.
So good morning, thanks for having me. Once again, my name is Damon Davis. I work as the Director of the Health Data Initiative at the Department of Health and Human Services, which is in the Chief Technology Officer's office. And so my job is predominantly focused on the data that HHS can make openly available for utilization across many of the different use cases that have been discussed already throughout this, this symposium. And so what I'm sort of want to focus on is the fact that we are trying so very hard to put out as much data as possible. Our data catalog has grown, I think, 397% in the last year. So we're really interested in sharing back the information that is vitally necessary for some of the different initiatives that have been launched across the nation in all aspects of healthcare and social services. For those of you that were at the Health Data Palooza earlier this week, I thought it was really interesting that an organization named Purple Binder was sort of touted so highly and put on the main stage as an innovation in social care delivery because it's a new aspect of how data is being utilized in an open data format, and I think that that's a really valuable sort of shining light for the opportunities that we have. But I think it really points to the fact that we need to acknowledge health and healthcare as sort of looking at the entirety of the individual, the person as a whole. It's not just them in the clinical visit, it's them out in their community and the social services that are available to them, the public services that are available from their state and local governments. And so my point in raising that is I think that we need to, from a data perspective, get to a position where we are able to gain a tremendous amount of knowledge from the mashup of all kinds of different data sources that tell a lot about the person, the community, the services that they receive, and the services that are available that they may not be receiving. So I think there's a lot of different opportunities across the data space that I work in. I want to also just sort of point out that one of the desires that we have is, so again, I work on healthdata.gov, and one of the desires that we have is to make healthdata.gov a real discovery zone for health data and social services resources, both across the Department of Health and Human Services, but across the federal government. So obviously HHS is sort of immediately thought of as, by default, the health agency, but the Department of Veterans Affairs has health information, potentially the Department of Education. And I could go on and name other sister agencies in the federal health space that we want to continue to liberate data from, so that we can be a source of fuel for all of the different ideas that you have in terms of service delivery and social change. But I think what's also going to be necessary as this data comes to life is some of the translational tools that are going to make it very, very easily understood, put it into context, have good quality metadata, the information about the data, so that you, who may not necessarily be a data expert, can quickly look at a data set, understand what's potentially in it, how it was collected and curated, and then very quickly understand, is this the type of data that is going to be right for me in the kinds of innovations that I'm trying to deliver? I think it's also going to be valuable, as I've also alluded to be able to link the data together. So it's not just about the ability to freely and openly access one data set, but how do I actually start to create some knowledge by the linkage of that data set to a completely, seemingly almost unrelated data set? What are the ways that we're going to be able to create some linked data knowledge generation that's going to help all of these creative ideas that I see drawn out across the walls of this room? And then, so finally, one of the things that I want to also make sure to highlight is the fact that we're trying to institutionalize the openness of the data as the default for the data. And so we've got a ton of information and data assets across the entirety of HHS. Some of them have been trapped in PDFs and really pretty graphs where you can't actually get to the numbers behind the data in order to replicate the study or the findings or what have you. And so what we've been trying to accomplish is actually the simple opening of those data sets as an opportunity for folks to find greater knowledge across the information that we have in all of our various government entities. So I just want to encourage you, I guess, as an ask back to you all, to tell us what kinds of data you are most interested in. One of our biggest challenges with having a platform that allows for freely, openly available data is we don't necessarily have really good information as to who's coming to the platform and for what purpose. What kinds of data are they really, really interested in? And so we're sort of lacking a demand aggregation function for our open data platforms. And I think it's really important to have these kinds of forums to allow the sort of public swell of opinion about what kinds of data you all need in order to pursue innovations in healthcare and social services, so that we can then go back, attempt to find that data, work towards its data, towards that data being liberated and made into machine readable format, so that you can very easily access it and use it for your own uses. So I'll just stop there with my ask back to you.
Thank you for those comments. Interestingly, yesterday we had a panel where we had representatives speaking about protected information, research information, and then kind of open data, big data. And as we were preparing this symposium, it sort of occurred to us that we actually have data silos now that are not necessarily connected in a way that would be really helpful as we look at a 360 perspective on a client. And I think you're representing that, and I think that all three of you have sort of touched on that. And it's, again, this integration or this interoperability between our knowledge and our data and our information that's so important, and that does show up on a lot of the notes here, which is really important, because one of the things out of the Health Data Palooza that was so overwhelming was just the amount of information that's coming. We think we've got big data now. We were joking yesterday, well, we're waiting for the gargantuan data onslaught, and how do we deal with that as people and our limited ability to sort of understand that stuff and make sense out of it. And I think that's part of the challenge we're going to face. We probably need to live to be 100 in order to be able to to consume that. So we have a little time left before we move to the next section. I want to open it up to see if there's some immediate questions from from folks out here. I suspect there are. Why not right over here? And just tell us who you are as well when you ask a question.
I'm crashing your party a little late. My name is Ross Martin. I'm the VP of Policy and Development at the American Medical Informatics Association, so thanks for letting me come. Hi, Jess. Hi, Damon. I actually have my question for Kshemendra, if I pronounced that correctly. Close?
You did.
Ah, great.
Congratulations.
So you talked about speed, quality, and money as being those things, and you emphasized maybe we need to sacrifice the speed as the thing and really do this more deliberatively. I like that idea, and the challenge that I think we all often have in this environment is the political environment of the pressure from the political cycle is do it fast so that we can show promise and progress within an administration, within an election cycle, within a deadline before the administration change. And we've seen this a lot in this space. Do you have suggestions about overcoming that inertia so that we can do this thing that crosses over those time frames?
I do have suggestions, and I work in a domain that has a lot of operational pressure. I work with agencies like the Federal Bureau of Investigation that are on 24/7 all the time under incredible pressure that's operational. The issue is this, haste makes waste, right? You want to be able to, we need to take a community approach, right? We have to recognize that ideas of interoperability, secure, trusted collaboration are not new. They've defined our landscape for decades, and we do the same sort of things. The story I have, I talked to my colleagues, with the National Association of State CIOs. So the joke with that group is no state CIO will sign off on a new MMIS system until he's within 6 months of retirement because he knows it's going to go bad. And
Fix that.
right, so sorry about that, Jess. That's not but it's the biggest IT system they're going to build, right? And so we're locked into the, this, interoperability industrial complex where, for political reasons, procurement reasons, the way we've always done it, we spend a lot of money in fragmented ways. It's in the public safety space, it's in health and human services. We have to recognize that we have to make a culture shift towards community-based approaches. Now, okay, that's good in theory. People are very scared of it because it's not how our political system, it's not how our public sector administrative kind of system works, right? So how do you make progress? Well, I go back to modular development. Everybody has said it. President Obama highlighted the need to change IT procurement, IT reform. So embrace that. Let's move towards a modular approach, but with a wrinkle. Instead of looking at a big MMIS or some other IT system in a stovepipe and breaking it up into modules and within the four walls of government just figuring it out and then going out and trying to do it, let's actually do it from a community perspective where we look at a responsible information sharing community, whether it's people that are doing benefits eligibility where you want to have a 360-degree view on benefits for at-risk youth, whether it's something like mental health and guns, whether it's something like heroin and this epidemic that's going across the country, and how do we get a handle on that? You get a mission community, and you say, what is the module that allows for effective, trusted collaboration through automated information sharing? Let's define our modules that way. And then let's try to develop that module, at least the specification, the business process, the policy issues, how we handle privacy, right? Let's try to do that together within the community. And let's work with our partners in industry and the NGOs, right? And the innovation community in Silicon Valley to be able to come up with that basic set of information. That's what we did with suspicious activity reporting. There, we basically standardized what was in my world called encounters, right? It happens every day. Police officers in their communities, something untoward is happening. They go and take action to protect their communities and the citizens there, right? But that usually ends up in an encounter, then a 3x5 card that's an officer-friendly shirt pocket. Rarely does it get into the police records management systems, and when it does, it's coded in different ways behind non-interoperable systems and policies. So we fixed that. 400,000 officers now in a consistent approach, neighborhood watch for the nation. Right? Those ideas translate, right? And you can develop momentum on that. And the wonderful and beautiful thing about it is that, you start to build capacity, and you can start to go faster across the community, right? It does require leadership. It does require, you know, folks at the top to embrace it. It does require some visibility, right? But, you know, you actually can shift the model away from these huge procurements that are almost guaranteed to fail towards community-based approaches where you're going to dramatically reduce cost. In my world, 25 to 1 is an example of the kind of cost savings at scale. Yeah, so, and now if I'm monopolizing, I should let my colleagues jump in on that one too.
Well, I just want to build on something that you said. So I heard in part of your message the idea that, you know, once the example is set for how you could change procurement, for example, the opportunity there is then to sort of share that knowledge across to other aspects of whatever the business or social service is. And it's really, I was sitting in a room not unlike this one day when someone said, you know, there's a contractor for the defense agencies, and he says, you know, I go to the Army and they say they need a helicopter, and it has to be different in the following ways. And I go to the Air Force and they say they need a helicopter, and it has to be different. This is a different helicopter than that one. But in effect, they're basically all the same thing. My point in raising that example is that we are often trying to differentiate the activities that we are doing in some fundamental way when in fact there are very many similarities that could just simply be built upon. And I actually find that challenging in the federal space. Ross, you were there for quite a while working, and one of the challenges is that we are oftentimes working in parallel, and it's challenging to figure out where some similar projects reside so that you can understand the synergies, immediately get to a place where you understand the template for what they've established and then adopt it as your own because it is a proven example in somewhere else and get moving. And that translates, I think, probably to almost any branch of government delivery, and it speaks a little bit to sort of the timeliness of the delivery of services and information as much as it does sort of the desire to, you know, manage the political cycle, the ability to sort of move quickly based on something that is already established as a practice in another part of your agency or government or what have you. So,
Great. I want to turn it over to Sid for a second, because what we're talking about here is actually some of the key conversation that got distilled yesterday, from yesterday and the prior day's conversation that we've actually captured on the board here. If you want to just take a couple of minutes, and that will set us up for the next part of the conversation, because there's some questions embedded in these recommendations that I think are important that we hear. You may not be able to see it from there, but Sid will sort of summarize this.
Thanks, Daniel. There's a lot here. You could write a book about each one of these. You all did some very detailed work on each of these families, but there's some common themes that jump out. And I think they touch in all cases on some of the federal possibilities and some of the challenges that you as a panel have thrown back to us. Early intervention is captured in at least two of these. Early intervention, and I mentioned the leverage, the special leverage you have over nearly 2 million births a year that you pay for. In some cases paying for prenatal coverage as well. But most federal money is for later intervention, and much more of it goes to later, more expensive, higher-end intervention. So there's a challenge there. There's also a common theme that came through very powerfully in terms of more of a focus on the family. Part of the federal fragmentation is this group does this kind of children, this group does that kind of children, this group does parents without children. We put up family assessment as though that were an ideal, which it is, but most of the assessment funding flows for something very different than family or comprehensive assessment that feeds into the kind of case management that's up here. And then there were three points at which, in addition to what we heard very helpfully from the Ways and Means staff yesterday, that touched on funding. Change the reimbursement model, pay for outcomes, eliminate federal funding silos. All those easy to say, but one of the questions it raises is, if most federal funding now, hypothesis, most federal funding in these arenas goes for non-evidence-based services, most federal funding now flows to later, not early intervention. Most federal funding flows for narrower assessments, not comprehensive assessments. How do we turn that around? people in the room, Don and others, have used 4E waivers and Medicaid waivers to loosen up some of your restrictions and move towards the challenge that you're explicitly and implicitly posing to us. You want more flexibility, state and local providers and funders. Will you accept more accountability? That's been the trade-off that we've been trying for since, in fact, the middle 60s, when we realized we had hundreds of federal programs that were fragmented. We've now redocumented that and re-diagnosed that, but we're still having the same conversation. It was pointed out yesterday that people are in the room in some of these meetings over interoperability who've never met with each other before. I first heard that in 1966 on Model Cities. It may not be enough just to assemble the players. The leadership and the funding changes may also be critical. So what's possible if most of the money and the power behind it that flows into the systems that we're talking about here for these people flows into doing it in a non-evidence-based, non-comprehensive, later intervention format? How can we turn that around? Where are the waivers that take seriously what you just said about community-based intervention? If the community is the right unit for generating political will, where's the community waiver? Some states have proposed legislation that says we will accept, if you give us the right kind of flexibility, a whole new kind of accountability for results driven by interoperable data. I don't know that there's a dialogue now between federal, state, and local agencies that captures that challenge to you and challenge to us at the state and local level as well.
Thank you. Thank you. Some brief comments on that,
Yeah,
if you have?
absolutely. I'll start with the end and work back a little bit. This idea of community waivers is very interesting to me. I have to say, after working for 20 plus years in state and federal government on programs for vulnerable people, and now seeing a lot of different proposals coming from states, that I'm highly skeptical about the intentions of a lot of the waivers that are asked from us in terms of the impact they are trying to have on the vulnerable populations. And I say that fully embracing my cynicism. But we don't always get asked to approve things that are meant to, we think, truly improve the social and health well-being of vulnerable populations as opposed to controlling cost. So I would like to think about a program like that would allow for the right kinds of communities, and by right, I mean the well-intentioned communities, to be able to interact with us. But let's be real about the political environment that we work in, and the fact that these funds are available at the state level for the most part, not at the community level unless our appropriations were to change. And that state government is putting a filter and doing some priority setting about what that means. Medicaid is the #1 cost in most states, sometimes second to education, but lately #1 cost. And states are struggling. And so if you're talking about something that's going to bear a ROI 4 or 5 years down the line, that's not something that those state legislatures want to talk about today. They want to talk about something that's going to get their money now and show some savings now, and that generally does not mean expanding benefits. So that, I think that as a conceptual model, there are not philosophical boundaries with us, because you're talking to the choir here who understands the social and economic determinants of health. We get that. The challenge that we see is that even when we have states who have proposed huge, and when I mean huge, I'm talking 5-year budgets that blow some federal agencies out of the water, huge 1115 waivers for service delivery reform for Medicaid and CHIP. And they do not come to us with a preset understanding of data, of the interoperability between providers that will be necessary to achieve those goals. And when we talk about the accountability for those outcomes, I think we need to do a better job of sharing that accountability. And by that I mean, and this will be coming starting this fall for us, but a monthly data set on everyone who's a Medicaid provider, all of the beneficiaries, what services they're getting, what are the encounters they're getting. And that means managed care. That means those managed care contracts, you can't just sign them and say bye-bye. You actually have to demand that encounter data at the kind of granularity and depth that will tell you that that's the right service delivery reform and that what that community proposed is actually working, and will give us the ability to say, we've seen this, and now moving forward, and we're actually building a system that will have the decision support to say, you want to put in these kinds of state plan amendments? If you're a state with these characteristics, these inputs, and this is what you're asking for, we can automate those approvals. Because we now have the data to show that that's a proven model, and we understand what your commitment is and what our commitment is. Now we have to read and approve everything in paper. And we don't have the ability then to turn around and say, this has been done, we'll let you do it in another place. So giving us that data would allow us to step back on that flexibility, but I think we also have to be really honest with ourselves about the political reality that we work in. And when people are talking about health and human services programs, and I have lived this through this whole marketplace discussion with the Affordable Care Act, don't talk to me about those welfare programs. I just want to talk about people going into the private insurance market. Every single time this has come up. And so let's be very careful that when we talk community, that we're really honest about that whole community and bring them all to the table.
When you turn down that kind of inappropriate, ill-intentioned request,
Mm-hmm.
do you come back with meeting people halfway with your prescriptions or your notions about a dialogue that would be the right kind of waiver, or do you just say no? And that's it?
There's actually a tremendous amount of negotiation that goes into these. There's a state in particular now that came out with something that was going to tie healthcare benefits to working. People would have to work in order to get healthcare benefits. Clearly that didn't go over really well with us. But we're still at the table, and we're actually really close to being able to approve something with them, because you give and you take, and maybe they had other pieces that they were willing to compromise on. It's never just a no, go away. It's a back and forth on things, and maybe they had to put that in. You know, we're very savvy. They had to put that in, but they were willing to give it up, right? So there's a little of this that comes and goes, and I would love for OMB or whoever is pulling our purse strings to be able to give us some flexibility to do two things primarily. One would be, let us build some things at the federal level that we can offer as shared services or code I mean, not even just code, I'll just say it, shared services, so that the states don't have to build it over and over again. Some key MMIS business functions, I want to stop paying for them. But that's not how our money comes. Our money gets appropriated to CMS for states. What we get pays our salaries, the bills, the lights, some reams of paper. Travel if we're lucky.
One idea, I mean, maybe to slow some of this down in the sense of maybe what would be interesting, instead of people applying for the 90-10 match, you know, they'll say, we'll give you the 90-10 match, but we want a couple of things. One, we want this program to be institutionalized and working and demonstrating impact according to whatever criteria you want. Maybe some of it's using open data, maybe some of it's partnering with the community, all these things, but you just say, okay, you'll get it, but show us that this works. Mm-hmm. You know, put some skin in the game, and you know, and then you'll get your money, rather than, because right now, you get the award, people run away, and you've lost control.
So
Just
when
an
I
idea.
put my NPRM out, make that comment. Because I think if we're going to continue to be able to fund the things at the level of funding that we are, there are going to be those kinds of strings. And it may not be that it's already built and it's sort of state does the R&D and we pay you back, but it may clearly be, it's not we're going to leave our money on the stump and come back in a little while and see how it's going. There'll be some parts to it.
That's exactly, just one second. That's exactly the kind of level of granularity we're going to move into in just a couple minutes. We want to come forward with some of those ideas across a couple of these domains that are actually potentially attainable in the near future. So just as a note for participants here, as we go into the next, that's the kind of level of detail and specificity we want to be able to then come back and have a conversation on some of these other domains. But go ahead.
Yeah, so this is an appropriate time for me to remind myself and the audience that I'm the token national security guy here at a Health and Human Services conference. I'm here not because of any mission, right, so nobody worry about that, but professional interest in sharing best practices and interoperability. The different spaces, health and human services, public safety, national security, all look a little different. So there's limits to the analogies, right? But it's useful to think about the analogies. Listening to Jess talk about things, I'm reminded about a couple of things that are going on in my space that might be interesting. One is culturally, the public safety community nationally has a little bit more of a paramilitary culture. So there's a little bit more of a lineup around national guidance. That makes, frankly, the problems I face a lot easier than I think what goes on in the health and human services space. So I wanted to put that out there as to preface what I'm about to say. But one of the things that we've been able to do with our partners at the Department of Justice, Department of Homeland Security, is special condition language on grants going to state and locals that are getting increasingly prescriptive around interoperability. There's always challenges on pooling different grant streams, good reasons. I think it's OMB Circular A86 or something like that kind of colors how you can break down the stovepipes on these grant funding streams. But these standards are increasingly becoming around information interoperability, right? So we think that can move folks towards shared services, shared capabilities, potentially cloud-based solutions, where we don't upfront have to say what exactly that looks like, or it's a federal solution. It could be a state collective, it could be owned by a nonprofit. An example in our space is there's an organization, one of the best kept secrets in the public safety space is an organization called NLETS. It comes from state to state sharing. So if you're here in Maryland and you get pulled over driving to the airport in your rental car, and you live in California and they want to check out who you are, they share license plate. Photos on the driver's license, things like that. They do 1.5 billion transactions a year securely across their backbone. Their budget's something like 16 million a year. It's really an amazing thing, and the reason they can do this so cost effectively is because their governance structure is stable, they have great leadership, great talent. It's a public sector entity, but it organizes a nonprofit governed by the 50 states, the same folks that sit on the FBI's CJIS Advisory Policy Board. There's lots of different models out there, right? And there's really, I think what we want to be able to do, or what I'd recommend you all do, is think about ways to not preempt pathways to innovation, right? That's critically important. So standards can drive innovation. The reason why these special conditional languages work is because they came from our state and local partners, right? So through FACO organizations and other engagement structures, right? These increasingly prescriptive special conditional languages have come up. So there is ways to do that and model on that. Obviously, it doesn't work to do unless the state and locals are bought in. And the point that I think Jess and others were making is that the states are very powerful politically, right? So a little bit of this, you have to do this to yourselves, right? We start with this thing I was talking about earlier about bottom up, and so that there's an opportunity, but also a huge responsibility, right? A lot of the problem is with how money flows to states, and states are used to that, and you all have to be willing to stand up and say, we're willing to hold ourselves to a higher standard.
But I want to add in one quick thing. I couldn't help but think of this discussion in a parallel to the changes that are happening in the clinical setting, where the provider reimbursement is being changed because you have to show that you are providing quality care in order to obtain your reimbursement. And it sounds like this is almost exactly the same conversation. And I think it's important to watch how that program unfolds so that you can quickly take lessons learned and say, okay, let's do that over here, not here. That's bad. But I just wanted to make sure to clearly sort of openly state that there's a definite parallel there that I think must be acknowledged in order to, as I said before, quickly understand what has transpired before, take lessons learned, and attempt to apply it in this new setting with the knowledge that you've already gained. I had another thought, but I lost it when I hit the cup of water. So I'll stop there.
Okay. Thank you for part one of this conversation. I think there's a lot of energy in the room around this.